World TB Day takes place on the 24th of March every year, but the truth is we should be thinking about TB every day, especially in Africa. 25% of all TB cases are in Africa and so are a quarter of all deaths. Around 10 million people fall ill with TB annually. It remains the world's most infectious killer and is also the leading cause of death for those infected with HIV. But how can we work together to resolve the TB crisis in Africa? To help us answer that is Jonathan Keytel, who's from the Strategy and Transformation Diagnostic Africa Director. Thank you so much for your time, Jonathan. We do appreciate it. I think that is the big question. We often underplay the seriousness of tuberculosis, and it's probably got a lot to do with the stigma attached around it.
Yes, good afternoon, Heidi, and good afternoon to everyone watching the show. Yes, TB is a very serious healthcare threat. It is caused by a bacteria which is transmitted, by coughing, etc. And so it really can spread quite easily, particularly within communities, etc. And so it certainly is a disease that has been prevalent in Africa. And it does cause a lot of disease and a lot of death. And we have a challenge also in our country and across the continent in that we also have very high levels of HIV infection, and TB is considered a co-infection there and proves quite deadly for people living with HIV.
Very concerning. I want us to speak about why those who might suspect they have TB, oftentimes they're reluctant to seek help and treatment, and that could possibly be related to the high death rate that we see from TB cases. Again, do you think this has to do with the stigma attached around it, and how do we tackle that?
So many diseases, there's a lot of lack of knowledge, I think, amongst people. Education and awareness is critical. And I think it's about communicating to people that TB is a treatable and curable disease. And what is really critical is that we have early diagnosis. So the real first step that's needed in most cases is to create awareness for people, help them understand the disease, help them to understand, what causes it, how it's spread, etc. And then the second step really is to encourage people to go and get screened for TB. And the screening test is relatively simple, and then armed with that information, we're able then, and health systems are then able to provide the treatment. And with treatment, there's a very good chance of cure and survivability.
Speaking of treatment, Jonathan, what about access to treatment? Because if you look at, and I know it's two different diseases, but if you look at what happened with the COVID-19 pandemic, Africa was really last in line when it came to COVID-19 vaccines. And I wonder if that's also the case with TB treatment, especially in, deep rural areas, especially in the rest of Africa. Is there a difficulty in accessing treatments, and does that possibly contribute to people saying, well, it's so complicated to get treatment, whatever happens, happens?
That's a really great question, and I think when we consider yesterday was World TB Day, TB is one of the diseases that has enjoyed a lot of global attention for many years. So there are numerous large-scale international organizations, including Stop TB, including the Global Fund for HIV, TB, and malaria. And so, TB is one of those diseases where there is a lot of focus on providing care. So both making various medications available, but also making the diagnostics available. So really linking together diagnosis of TB and then making sure that treatment is available. So I'm quite happy to say that within the context of Africa, we do see good access to the medications, and we see growing access to the diagnostics. And this is actually where recently the WHO has also promoted or added a whole list of additional diagnostic tools to their guidelines, and this is increasing the opportunity for governments and countries, and therefore also patients, to access diagnostics and then that linkage to care. Fortunately, TB drugs, they've been around for some time, and they are available in most markets.
That's some great news to know that, governments are doing all they can to get those who are in desperate need of treatment to access that treatment. I want to ask you about the fact that we know World TB Day is on the 24th of March. You have governments, and here in South Africa we have the deputy president having a whole speech and day dedicated to World TB Day. But does that really help beyond World TB Day? Should governments across the continent be doing more in terms of educating and really empowering communities to understand the severity of TB and that it is curable if caught on time?
Yes, so it's of course important for us to have a global day to raise awareness for tuberculosis, and that is World TB Day, which is celebrated on the 24th of March every year. But to your point, I think we should be talking more. There should be a continuous dialogue around diseases, and what can be done about these various diseases. So we have TB, we have HIV, which is a big challenge on our continent. We also have emerging or diseases that are often not spoken about. So, for example, various cancers. There is a very large proportion of cervical cancer in Africa, and that is also caused by a virus. So it's also something we can test for. So I think as a healthcare company, but also as civil society, government, non-governmental organizations, we need to really be bolstering the conversation and the dialogue around, firstly, awareness of diseases. How do we ensure that people know about diseases, they know about diagnosis? And I think, COVID was very, very interesting in that it really drove a lot of diagnosis. Working in the diagnostics industry, one of the things we observed was that the man in the street started to understand what diagnosis was. Everyone was getting a PCR test or a COVID test. And so there needs to be a lot more dialogue around the fact that diagnostics is the critical first step to treating and curing any disease. And so from our side, we partner with a lot of governments, a lot of international organizations to really drive the dialogue, but also we're working very strongly to strengthen the systems, strengthen institutional capacity across the continent to diagnose TB, but also to diagnose a whole range of other diseases, really with a focus on driving health for every African.
Certainly. Thank you so much for your time. We do appreciate it. I think it's important to take away that it's important to have these conversations because prevention is better than cure at this stage. That was Jonathan Keytel, who's Strategy and Transformation Diagnostics Africa Director.